When working with conditions of the arms, and this can be something like lateral epicondylitis, medial epicondylitis, carpal tunnel syndrome, shoulder conditions, what I find works really well is to use points on the opposite arm. So if they have a condition of the wrist, maybe it's carpal tunnel, or even arthritis, or medial epicondylitis, any kind of condition, we want to treat the opposite side. And in the balance method and the master tongue approach, we often do opposite side needling. Now, we're used to speaking about mirroring the feet to the hands and the knees to the elbows, and we speak of mirroring the shoulders to the hips. But we can also mirror one arm to the other arm. So if the patient has a problem on the left arm, then we can needle the right arm. And we want to put the acupuncture needles in the same area they have pain. So if she has carpal tunnel syndrome and she has pain in her wrist on the medial side, on the yin lines, I'm not going to needle the affected side. I'm going to needle the opposite side. So I can do PC6, I can do any number of other points through there. But what I want to do is I want to get those needles precisely in the same area where she has pain, okay? And this also applies to the medial elbow, so like golfer's elbow or tennis elbow. If the client has pain on the left side from LI11 to LI10, then we'd want to needle the opposite side in those same areas. So if the pain is from LI12, LI11, and LI10, then I would do 3 needles to cover that area. And typically, I'm doing at least 2 needles in either the wrist or the elbow, but I'll frequently do 3 as well. If they're a hyporesponder, if they have a big body, if they don't get strong chi sensation, then I'll be using 3 needles. However, if they're hypersensitive or a smaller person and they get strong dai chi, then I can often get away with just doing 2 needles, okay? So the key thing is you want to make sure though that you get the needles on the healthy side covering those areas where they have symptoms, okay? And this applies to the shoulder, the elbow, the wrists, and the hands, okay? And I've used this for many different types of conditions with good success.